Today we're going to talk about modifying exercise in the painful population. So as medical professionals in this situation, we're talking about physical therapists that are either prescribing exercise for the patients or doing exercise in the gym with their patients. How much modification is too much modification? Why are we modifying? Are there things that we should be doing before we try to exercise with them so we don't have to modify? Those are the questions that we want to address in today's post. So first, let's take a look at the different ways we can modify our exercises. So we can decrease weight, increase weight. Remember, we talked about loading earlier in this series. Sometimes we find that doing just body weight or light weight is actually harder for our patients. So sometimes increasing weight is a way to modify. Changing the range of motion. So if somebody has pain with a full depth squat, only having them do a quarter squat. Changing the speed of the exercise or the technique, changing the plane that it's in, so instead of being all the way in one plane, moving out into a plane that's less painful or we can get full range of motion in. Decreasing the complexity of the exercise, something complex like a clean and jerk or a snatch, breaking that down into its components, or changing the duration or reps and sets so we're not fatigued. Now let's look at the reason why we do these things. So normally we do these things because we're trying to get our patients around pain. And why do we have pain? We have pain because it's a symptom of the root cause of the problem, which is neuromuscular inhibition and misfiring and altered biomechanics. So doing all of these things on a small level for a short period of time may be called for so we can just get the patient going. But a huge red flag would be if we're doing several of these things to get through an exercise and we're doing it on a consistent basis. So if we continue to modify the range of motion that they're going through and we're decreasing the complexity of the motion, and the motion is something that should be functional for them, then that's telling us that they're not ready to do this exercise. We need to go back and figure out where the root cause is breaking down and what we need to do to prepare them to do the exercise without too much modification. The other thing that we do a lot as physical therapists is also personal trainers, massage therapists, chiropractors, is we start adding things to our patients to give them more support. So tape, braces, some type of assistance or a spot. So obviously sometimes we need spots because we're going heavier load and they just need assistance to get through that. But if we're adding braces and tape and orthotics and special shoes and all that kind of stuff to their exercise, that once again is a red flag that there is a bigger underlying problem that we are not addressing. So until we get to the root cause and we reverse that and we can exercise without modification and without some type of external support, then we as professionals have not done our job and we have not addressed the issues that our patients are coming to us for our expertise